Tropical Medicine and Diseases in the Returned Traveler. He's published widely on this area. He is the most knowledgeable on the risks that young people take when they want to go on an adventure vacation. Yeah, right. It's not just the alligators. Not just the alligators, no. So we are really fortunate to have him with us today. And so I'd like you to welcome Dr. Jay Keystone.
By the way, when he speaks, gives talks, is he funny? I just want to know.
Yes.
No. He's hysterical. I think he's hysterical, if not historic. Okay. So, my name is Jay Keystone. I'm up here. One of these guys is me, and the other is my identical twin brother, Ed, who is probably one of the top 10 rheumatologists in the world on the new biologics for treating rheumatoid arthritis. And you wonder why he's here. Well, my job this morning was to put this presentation together. That's my contribution. Ed's contribution was the 5.2 million stem cells when he gave me my stem cell transplant 3 years ago for a bad disease. And so, with my contribution to talk and his contribution to stem cells, without which I probably wouldn't be here. So he actually is here, right? All my B and T cells are his. They're in here today. So he's here with you, you just can't see it. That's why he's here, and that's why ever since he gave me the stem cells, he's been on every talk, or at least acknowledged at every talk that I've given since then. So I'm going to be talking about important tropical diseases. And I will remind you that this talk may be politically incorrect and in poor taste. Viewer discretion is advised. And that's no joke. I have been banned by the Department of Medicine from giving talks. I'll explain later how that came about. So let's start and remind you that it is a dangerous world. And of course, if you fly Air Canada, I just came in last night an hour and a half late. I went to bed at 2 o'clock this morning, so not quite all here, thanks to Air Canada, whose motto is, we're not happy until you're not happy, right? Anybody flown Air Canada would know that. There are also increasing difficulties crossing international borders, especially to the United States. But it's not all that bad. It says, oh, I'm not flying anywhere, I'm just here for the pat down. Certainly if you can't get a date, just go to the United States. But I like, this is my favorite, the airport scanner calendar for 2011, which I think is absolutely brilliant. And I did go through one of those yesterday as well, so I don't need a night light at home now. Okay. So let's take, on the right-hand side, 100,000 travelers. 70% will have some type of health problem. 10% will see a physician or stay in bed. 1% will be incapacitated from work. 0.1% will be evacuated, and 1 dies. That's roughly the degree of illness. Now the question is, what is it and why is it? So if we look on the left-hand column, you can see of 100% of travelers, almost 50% will have traveler's diarrhea, which is why my brother bought me a t-shirt when I first started tropical medicine that said, number 2 is our number 1 business. Absolutely right about that. If you follow it down, malaria, respiratory infections, hepatitis A, dengue, hepatitis B, typhoid, and down here near the bottom, things like meningitis, with a few others in between. And this is the monthly incidence estimated of health problems for something like 100,000 travelers. Okay, so one of the interesting things about travelers is that we are sentinel chickens. Does anybody know what a sentinel chicken is? You taught what a sentinel chicken is? We have sentinel chickens all across Canada. And what they are, they're chicken flocks, that small numbers, usually isolated in a local area, And then every so often, the blood of the chicken is tested for things like West Nile, Eastern equine encephalitis, or a variety of diseases that we may not yet have. And so if the chicken gets sick, we know there's something, or has the antibodies, we know there's something in that area that we need to be worried about. And travelers are wonderful sentinel chickens, and in fact, there is a global surveillance network of the International Society of Travel Medicine, ISTM, and the Center for Disease Control in Atlanta, and it's called GeoSentinel. And it's a worldwide data communication network that collects information about ill travelers. And we are if you look here at the GeoSentinel sites, I'll show you where Toronto is. Here we are. We are, of the 54 sites, where Toronto is the 4th largest contributor to information in this network. Now, the network currently has over 160,000 travelers in their database, and if we look at post-travel, about half of that, 80,000. Mostly made up of tourists, 60,000, business, missionaries, and VFRs, who I'll talk about a little later. Now, I'm only showing you to give you the idea that we can track disease in the developing world using travelers. And here's one example. In Sabah, Borneo, there was an eco-challenge where they had to swim, cycle, go through the jungle, and we saw a case in Toronto of leptospirosis. There was a case in London, England, and another one in New York. Now, an individual case would mean nothing, but when all 3 of those cases, the data was sent to CDC during that week, because that's what we do, we send all of our data on our ill travelers to a data bank. Suddenly, there's something going on. 3 cases of leptospirosis in a week from the same area. We now knew there was an outbreak of leptospirosis in Sabah, Borneo. And so that's how this network works, in part as a surveillance for emerging infectious disease, and the other part is to look at what happens to travelers, what makes them ill, and what are their risks. So I'm going to talk about the second part, what makes them ill, but I think you should know about the first, because I think it's very cool. This is actually one of the most effective surveillance networks in the world for emerging infectious disease. Okay, so I'm going to talk about illness in the return traveler. I'm going to do syndromes, I'm going to do syndromic things, GI, dermatological, and talk about different types of travelers. And I'm only showing you about 2/3 of the data, meaning 2/3 of the groups that have been looked at. Well, let's start with the Sentinel article, which was in the New England Journal in 2006, looking at the spectrum of disease in ill travelers, just to show you, there I am. It'll be the only time you'll ever see me in the New England Journal, except if they put my obituary in there, which is probably not likely. It'll be in the Canadian Medical Journal that no one reads anyway. All right. So what are the illnesses in return travelers? Fever, acute diarrhea, skin problems, chronic diarrhea, and GI nonspecific. So if we take number 2, that is number 2, number 2, 4, and 5, essentially GI problems are the number 1 problem. And then fever, very important, and skin problems. And you'll notice that certain areas of the world have certain kinds of problems, which I'll show you in a minute. So GI problems are the most frequent illness in return travelers, and that was confirmed by the GeoSentinel data. And why is that? It's because of the 5 F's, the intestinal protozoa. Or it should be intestinal infections, flies, fingers, feces, food, fomites, and fornicate. Fornication. Get that confused with formication. Because I deal with a lot of delusional patients. They do have fornication. So these are the ways that illness are transmitted, and in the developing world, I would like to tell you that the world really is covered in a fecal veneer. Okay, fecal veneer. And if you don't think so, just think about this quick anecdote. We all all go to the washroom. Some of us wash our hands. But many of us are wearing trousers, as you are today. You get off the toilet, what do? You do your trousers up. Now you've contaminated your belt. Then you wash your hands, and then you walk out of the washroom. So your belt is contaminated. The bottom line is there is no way that we are going to keep germs from being transmitted. However, if you're sitting during the summer with nothing to do, you can kill a few flies, have them sunbathe, have them do the Olympics, coming up in London, or even in India, standing against the wall doing your thing. Okay? Just something for pleasure. So let's start with fever. Level with me, doctor, just how high is my fever? Roasting marshmallow. All right. So if we look at the most frequent cause of fever in return travelers, by far, it's malaria. And notice, most of the malaria comes from sub-Saharan Africa. And notice there's almost no dengue in sub-Saharan Africa. It's mostly in the Caribbean and in Southeast Asia. Very little dengue. And probably because dengue is a flavivirus. Anybody else know a flavivirus in Africa? We call it yellow fever. So yellow fever and dengue are both flaviviruses, which is maybe why we don't see so much dengue. Infectious mono, rickettsial infection, the number one is in sub-Saharan Africa, that I'll mention in a minute, and typhoid, salmonella, mostly in the Indian subcontinent. Okay, and I'll break that down in just a minute. All right, so the fever etiology, sub-Saharan Africa, malaria, mostly falciparum. Caribbean, Latin America, and Southeast Asia, dengue. Dengue is now the commonest cause of fever from Latin America in travelers. Indian subcontinent is typhoid and paratyphoid, and in southern Africa, I really mean South Africa, it's rickettsial infections. Okay. Remember what he said, one of the brighter things, probably the only bright thing, fever in the return traveler is malaria until proven otherwise. That's really crucial. Our Prime Minister said the same thing. Fever in the return traveler is a medical emergency, but nobody understood that was the problem. Okay? Bottom line, these are two very important statements. And if we look at fever in return traveler, I want to show you one major thing. Notice this is malaria at the top, but respiratory, bowel, dengue, and below here is urinary tract infection. So when we think of people coming back with a febrile illness from the tropics, the first thing we think about is tropical. Well, clearly you have to think about malaria. Remember what he said. If you look at the causes of fever, tropical disease more frequent, but non-tropical made up a third. So fever from the tropics is often not tropical, but is malaria until proven otherwise. So I'm talking about urinary tract infections, viral infections that you could have gotten right here, influenza. So it's not all exotic disease in return travel. And I just want to show you the new seal for the Prime Minister. It's a condom. And there are very good reasons for that. The federal government announced today that it's changing the coat of arms to a condom because it more accurately reflects the government's political stance. A condom allows for inflation, halts production, destroys the next generation, protects a bunch of pricks, and gives you a sense of security while you're actually being screwed. Okay, just to point that out clearly. You can tell that I don't vote conservative. Okay. So the other thing about malaria that you may or may not know is we now have 5 species. 5, count them. Okay, we have falciparum, we have vivax, we have malaria novale. You knew all about that. We now have a monkey malaria called Nolazine, and that's all from Southeast Asia, and it kills like falciparum. And if we look again at where malaria comes from, and these are from the CDC data, you can see here 90% of the killer malaria comes from Africa. 44% of vivax comes from Asia. Those are the two major locations. And the key, of course, is the killer, which is falciparum. All right, and who gets malaria? That's the real question. Well, it's pretty straightforward. You can see here, 50% of imported malaria is in BFRs. Now tell me what a BFR is. Anybody?
Visiting.
Louder?
Visiting friends and
Visiting friends and relatives. So how many in this room, you or your parents, were born in a developing country? 1, 2. Okay. Actually, in the medical class, it's almost half. Almost half in the med school. So VFRs, tourists, missionary, business students. Why VFRs? Because VFRs, especially those who live in malarious areas, especially in West Africa, have had malaria 100 times when they were kids, and so it's like the flu. Now, I don't have to worry about it. I had it all the time. I don't need anti-malarial pills. I don't need to take precautions until they realize, or until they die, is that when you leave Africa, or in a highly endemic area, within a period of time, you lose your immunity. And last year in Canada, 20% of the deaths from malaria were in New Canadians, VFRs, because they felt that they were already immune and didn't have to worry about it. Bad news. Okay, if we look at the most important vaccine-preventable infections, enterotoxigenic E. coli, right? That's the one that causes traveling diarrhea. And notice, influenza is number 2. Hep A, Hep B, typhoid, and right at the bottom is cholera, remarkably rare among travelers, about 1.5 million. So these are the most common vaccine-preventable infections. If we look at influenza in the tropics, 2.8% of all travelers, especially the Southeast Asia, acquired influenza, 70% were symptomatic, and the incidence of 1% per month. Any idea why travelers to tropical countries might be at greater risk of influenza, aside from the fact you travel by aircraft? Well, this map shows you. Influenza is transmitted year-round in the tropics. North America, it's seasonal. And in the southern hemisphere, it's seasonal. But it's year-round in the tropics, and that's why we see it more frequently in travelers. Okay. Now, this is a woman who's jaundiced from hepatitis A. And I used to think this was not a big deal. You turn yellow, you go to the bay, buy something that matches yellow, like the navy blue, very nice yellow. And after a couple of weeks, you're perfectly fine. I thought it was a pretty benign disease. Until you look at the data by age. Look at this. By age 50, this is not morbidity. This is mortality. Mortality from hepatitis A is 2% over the age of 50. Okay, I'm here almost 70. I'm like, hello, I'd be off the chart. Be dead in a week. So the older you are, the greater your risk of dying from Hep A. Children under the age of 5, they don't even know they've had Hep A. We call them super spreaders, right? They just spread the infection to daycare and everybody else because they don't know they've got it. But older people die from Hep A. Hep B, tattooing, right? Can I ask how many in this room have a tattoo or piercing? That's exactly what I thought. About a third. And I've done these surveys across the province. Okay, about a third of young people have tattooing or piercing. Here's my favorite tattoo. I absolutely adore it. I think it's absolutely brilliant. I thought of getting it, but I'm starting to hang over my belt so you wouldn't see it anyway. So, why am I so concerned about hepatitis B in the developing world? It's not because of sexual activity, although clearly that's a factor. This is a study done by a colleague of mine, David Hill, They looked at 350 travelers, medical care stopped by 8%, 17% received an injection. And you say, well, that's no big deal. At least it got the medication in. Until you look at the British Medical Journal in 2003 and a study on the use of unsterile equipment in the developing world. And here it is. Now these are the number of injections given per year in each area of the world. Eastern Europe, for some reason, they don't have tablets. Like the average number of injections per person was about 10 or 11. Unbelievable. But notice here, Southeast Asia, the dark part of the bar is the proportion of injections given with unsterile equipment. So if we look at Southeast Asia, and this is a lot of this, the Indian subcontinent, Eastern Mediterranean, mostly part of the Middle East, especially in Egypt, 2/3 to 3/4 of injections are given with unsterile equipment. That's pretty frightening, which is why every traveler should have hepatitis A and B. B not because they might be sexually active. At my age, I don't know what that means. But what they do need to think about is unsterile equipment. So the most frequent vaccine preventable diseases, ETEC, influenza, Hep A, Hep B, and typhoid. And I'll talk about typhoid in a minute. Vector-borne disease, dengue. Notice dengue increase in the Caribbean and Southeast Asia. Why is dengue on the increase? Tell me why dengue is a major increase today. Anybody know? Any thoughts? Okay. By the way, I'm not wearing my hearing aids, so when it's quiet like this, I don't know if you're talking and I can't hear you. Okay. My hearing aids are in my bag. I forgot. So dengue, fever, rash, muscle and joint pains. Okay, very classic. Dengue markedly on the rise in the last 20 to 25 years and even higher now. And here's the reason. Dengue mosquito breeds large bodies of water, small bodies. Anybody know? Small. Tin cans, flower pots, footprints. And in 2010, the world became more urban than rural. So now we have more people in urban areas, where before that they were mostly rural. Dengue is an urban disease because we have trash. We have it, I showed you a second ago, one of the largest slums in Asia. This is in Mumbai. And so with all the slums and the garbage, you've got perfect breeding locations for the dengue mosquito, the Aedes mosquito. We also now have chikungunya, that which bends up. Okay, you can take that in any way you want, but chikungunya causes, anybody know the difference between what the symptoms of chikungunya and dengue? Anybody? How many of you have heard of chikungunya? Just, well, you should, because chikungunya is on the rise, and the word Swahili, it means that's which bends up. And if we look here at dengue on this map with all the push pins, now let's look at chikungunya. Okay, in 2005, they had chikungunya coming from Kenya, Madagascar. They even had a big outbreak in Italy, 180 cases, and then down here to Indonesia. In this area of the world, not the Western Hemisphere, we have huge numbers of cases now of chikungunya, transmitted by an Aedes mosquito. And the difference between chikungunya, dengue plus arthralgia or arthritis equals chikungunya. So dengue causes muscle aches and pains, chikungunya causes joint pain, swelling of joints. It looks like dengue, except you have arthralgia and arthritis, where dengue just has myalgia, muscle pain. I want to know who that is. Actually, it's very relevant to where we are today. That's Sarah Palin, before she went into politics. And we're in the Sarah Palin building, aren't we?
Close.
Close. Not quite, but close. Okay, well, it all depends what floor. Are we
That's
on?
right.
We're in the Palin building below?
We're in the Palin building.
Palin, and
But if you
upstairs
went
there's
upstairs,
the John building. Okay.
If you
All right.
can build it.
Sarah Palin Village. Sometimes I feel that I have the worst job in the world, and the other guy says, yeah, right. Okay. This brings me to another enteric disease, and this is typhoid, Salmonella typhi. Okay, notice we have 4,000 travelers. Most of the typhoid and paratyphoid comes from the Indian subcontinent, South Asia. Okay, Salmonella typhi, mostly in VFRs. Mostly in VFRs. Okay, let's look at this. These are data from the CDC. They looked at something like almost 2,000 cases. 80% of the cases came from 6 countries, but notice most of it came from India, Pakistan, and Bangladesh. Okay? Who got it? Who were the travelers who acquired it? Come on in, boys. 66% of the cases were in VFRs. And VFRs, mostly in the Indian subcontinent. Notice children were a big problem, 40% in children, and majority of them were hospitalized. So it's not a fun disease. So I like to tell people who should be immunized for typhoid. If you're flying over India, you probably should be immunized. The Indian subcontinent, especially India, has a huge amount of typhoid. Okay. And the other big problem with typhoid is we look at drug resistance. As you can see, follow this line up here. Nalidixic acid resistance is rapidly increasing. Nalidixic acid is the basis for fluoroquinolones, ciprofloxacin, norfloxacin, ofloxacin. And so we now have resistant Salmonella typhi. In fact, 87% of the typhoid cases were nalidixic acid resistant. We can no longer use fluoroquinolones for typhoid. We have to use ceftriaxone or azithromycin. So we talked about malaria, dengue, salmonella. I'm going to mention rickettsia. The major source of rickettsia in travelers is something that produces this. A traveler from South Africa with a black necrotic lesion, an erythematous margin, often missed by the traveler, which is why you have to make sure you examine all the skin. Fever, local adenopathy, and this comes from South Africa, which makes up about 90% of the rickettsial infections in travelers from all over the world. 90% is from South Africa. Any idea what rickettsia this is? Well, it is a rickettsia. It's called Rickettsia africae. And the name of the disease is African tick bite fever. It's transmitted by a tick, and it's African tick bite fever. You often don't feel the tick bite. And so we're looking for someone who presents with a fever and clearly not likely to be transmittable in Canada, because you need a certain tick vector. And it can occur anywhere on the body. I had a phone call, black necrotic lesion on the penis. I had a phone call from Lindsay, Ontario, a physician, and it was a woman physician. I have to mention that specifically, but the next line. So she phones me up and says, I have somebody with a black necrotic lesion. He's got lymph nodes, he's got fever. He's from South Africa. He was in South Africa. She said, do you have any idea what this is? I said, of course I know what this is. This is dick typhus. Well, complete silence on the phone. I, on the other hand, am killing myself, thinking it's the funniest thing I ever said, which it probably was. Okay? And she said nothing, completely quiet. Anyway, bottom line, from South Africa, the commonest cause of fever is African tick bite fever, and you look for the black necrotic lesion. Okay. This says, without thinking, Captain Hook uses the wrong hand. I apologize for those who are disabled. I am disabled. I have a handicap sticker. All I want to do is outlive my handicap sticker. So I could imagine not being able to park anywhere. Okay, that's all I want to do. And I might be able to, but there's a question about it. So traveler's diarrhea, as you know, big problem. mostly in the brownish red areas here. But what's happened recently is that from about the Middle East eastward, you have fluoroquinolone resistance. Ciprofloxacin no longer works in the eastern part of the world. You can use quinolones here, you can use quinolones there, but for treatment of traveler's diarrhea, and I'll give you an example, in Thailand, 100% of the Campylobacter bacteria are resistant to quinolones in Thailand, 100%, which is why we now have to use azithromycin in Southeast Asia. We no longer use quinolones. Where do you get the most traveler's diarrhea? Start at the bottom here, India and Nepal. If Spain is 1 in terms of the risk of traveler's diarrhea, India and Nepal about 500 to 600 times more likely. Peru, Cuba, believe it or not, Dominican Republic, Thailand, Costa Rica, China, and Mexico. Notice, Dominican Republic and Cuba even more likely to have traveler's diarrhea, which isn't as bad as Mexico where they just kill you. So I think I prefer my traveler's diarrhea in Cuba and Dominican Republic. But the bottom line is, these are very common locations. This is where travelers come back with traveler's diarrhea. Okay. What about skin problems? This says, is it contagious? Well, some of them are. We did a paper on dermatological risks in returned travelers, and notice insect bites, larval migrans, rashes, leishmania, myiasis, scabies were among the top causes of skin problems in returned travelers. This is a traveler with insect bites. My question to you is, what was the insect?
Bedbugs.
Louder?
Bedbugs.
Bedbugs?
Yes.
Excellent, I even heard that. Remember to speak in your outdoor voice. Right? Bedbugs. Why? Breakfast, lunch, supper. It's a bug that bites and moves on. Fleas can do that, and reduvid bugs from South America. Breakfast, lunch, supper. This is cutaneous larval migrans, which is a dog or cat hookworm that migrates. Doesn't cause any major problem, but is incredibly itchy. Unbelievably itchy. This is from Belize. Anybody know what you get these boil-like lesions from Belize? Belize is the 4 B's. Belize, boils, botflies, bacon, because some people can use bacon to treat it. So this is a boil, and inside is a maggot. Okay, this is a botfly larva. It's a remarkable life cycle. The botfly, which doesn't affect humans, lays its eggs on the underbelly of a mosquito. Then the mosquito lands on you, the eggs drop off, the larvae penetrate, they develop in your skin, and after about a month or 2, they pop out and you get a new fly. That's the botfly from South America. This says, please be safe. Do not stand, sit, climb, or lean on zoo fences. If you fall, animals could eat you, and that might make you sick. Okay, so my point here is animals and humans. This is a study looked at in travelers, again, the Geosentinel Surveillance Network, and Geosentinel has about 30 papers, scientific papers, looking at the epidemiology of travel-related diseases. And what they showed, we used to think that you should only give rabies vaccine if you're going for 3 to 6 months a year. The median time from the time they were bitten was day 23. Only 66% received post-exposure prophylaxis, and children were the highest risk. That's who we're mostly worried about. Children traveling in the developing world. It's interesting, there was a difference between males and females just a bit. Females are bitten by monkeys, males are bitten by dogs, right? Because monkeys are cuddly, they're furry, and then they bite. Okay, what about children? These are mine. I have to point out to you 2 important things. Here is David, here's Kevin. Kevin is 26 and he's gay. He's looking for a boy. David is 31, he's looking for a girl. Here's my home number. If you have somebody you'd like to fix up with my sons, that would be wonderful. I accept collect calls. In fact, in my family, we have 2 gay children, 2 straight, and 1 adopted. We have something for everybody. Okay? So, illnesses in children, diarrheal needs like adults, dermatological a little bit more, febrile about 1/4, but this I want to show you, 6% had animal bites. 6%. And one of the things I tell families who come to see me and take their kids, I say the following. Actually, kids are sitting down in front of me and I say, kids, you need to stay away from animals for very good reason, blah, blah, blah. And then I say this is really important. But if you're bitten, make sure you tell mom and dad because they want to know. You tell a kid, don't go near an animal, and they're bitten, they're not going to tell you. And so I always make sure that mom and dad are sitting there and the kids know if they're bitten, they will tell their parents. Cute little puppies on their iPhone, and rabies is the problem. Okay, what about VFRs, visiting friends and relatives? Well, this happens to be my wedding picture, actually about 1.5 years ago. And my wife, Margaret, who was born in Tanzania, but she's South Indian from Goa. And here I am, I'm not going anywhere. Well, I am, God calls me. VFRs, as I mentioned, are a particular risk when they travel because they often think they're not at risk. And VFRs are greatest risk of malaria, typhoid, TB, sexually transmitted infections and parasites. I've said this before, they don't seek travel advice and they stay in the highest risk areas. They go to rural areas, they often don't have screens on the accommodation, and they eat local food prepared locally, which of course we do as travelers, but often not necessarily in the most hygienic way. What about sexual activity? I love what Woody Allen said. Having sex is like playing bridge. If you don't have a good hand, a good partner, you better have a good hand. And anyone doesn't understand that, come after, I will explain it. Actually, you don't have to come, just come over to my desk. All right, and I love what Sharon Stone said. Women might be able to fake orgasms, but men can fake whole relationships. That's probably true, the two genders. So, sexual activity and travel. I want to show you a very important slide. This was a meta-analysis, but I want to show you this from that meta-analysis. As you might expect, alcohol, drug use, males mostly, under 25, they don't have a steady partner, they may have casual sex at home, or they may have the expectation of having sex when they travel. But that's not the most important line on that slide. The most important line is this one, right here. 55% who have sex with a new partner when they travel didn't expect to have sex. And so I used to say to young people, well, you know, make sure that you don't have sex with locals, it's suicide, in certain parts of the country or world. Now I say, I don't care if you don't think you're going to have sex, carry condoms. Because there's a good chance, or a reasonable chance, you might. And that's very important to think about when we think of travelers at risk. Motor vehicle accidents. This is illness not in the return traveler, but the non-return traveler. This says, honk if you love Jesus, text while driving if you want to meet him. Okay? The #1 killer of travelers is motor vehicles. 40% of those who die in motor vehicles. Less than 1% of those who die from infectious disease. 40% versus less than 1%. And so I have one major rule. For you guys, I have two. Don't even think about traveling by road in rural areas after dark, ever. That's by bus, by taxi, by chauffeured limousine. And if you guys can help it because you're young, stay off motorcycles. That's the other big killer. So, what's the bottom line? This says 3M duct tape making the world a pretty place. I mean, surely during the summer you wish you had a roll of duct tape, right? Okay. This is travel medicine for dummies. This is all you need to know. Don't get bit. Don't get hit. Don't get lit. Get drunk. Don't do it. And don't eat shit. That's all you have to remember. And you will likely stay healthy when you travel. Thank you very much. Okay. So I've kind of given you the overview of illness in travels. Anyone have any? We started late, but I'm actually right on time. Scary, isn't it?
It's very scary.
Any questions?
By the way, I just wanted to do a follow-up for you. There was a talk given by an epidemiologist from the University of British Columbia on the greatest risk factors for snake bite.
Right?
It's the 3 T's. Testosterone, tequila, and tattoos.
Exactly. You hear that? Absolutely right. Question?
You mentioned that 100% of travelers diarrhea, or I think it's Southeast Asia, are resistant.
Okay,
100%?
what I want to point out is that traveler's diarrhea in Southeast Asia, most of the bacteria are now resistant to quinolones. So we can't use ciprofloxacin, norfloxacin, ofloxacin. We can only use erythromycin for self-treatment or for prevention. And I think everyone who travels should be carrying Imodium and an antibiotic, and you use them together, because Imodium plus the antibiotic is better than the antibiotic alone. You use them together. Any other questions? Okay. Yes, sir.
Just going back to the earlier part of your presentation, how is information or cases, how are they transmitted over to that GeoSentinel?
Okay. Every site in GeoSentinel fills in a form, non-nominal. We have no name attached to it. We list where they've been. We list the diagnosis as soon as it's available, and it's emailed directly to CDC. So virtually every week we send information to CDC on all of our travelers. Yeah, that's why they have 160,000 now in their database. Thank you. You're a great audience. You stayed awake. Nice to meet you. I don't know if I'll be back. I don't know if they'll let me back. Oh, wine banned in the Department of Medicine. Something like this. A couple more F words in the presentation. I didn't say them, I just read them. And I was banned from giving lectures in the Department of Medicine 3 years ago. But the follow-up, and I didn't know at the time, at the end of the year I found out that that lecture that I was banned for was the highest rated lecture in the entire year in the Department of Medicine, with an evaluation rate of 98% excellent. And it wasn't just the humor or political incorrectness, it was the information and my ability to keep people awake. Just to give you the back. I haven't told my chief, you don't want me to lecture, I've got other places to talk. Thanks very much.
Thanks on behalf of the class, and you're always welcome here.